All right, I like that music, Chris. Good choice there. Hi, everyone. Dan Edwards with you from Pivotal Media. And here we are. Great to be with you once again. Glad you could join us for another Kettering Health Chats Live. The reason that we do this is that it's an interactive forum for you to ask questions of our doctor. And it's a kind of a cyber house call, if you will. And tonight's topic, since it is National Lung Cancer Awareness Month, guess what we're going to be talking about? You got it, lung cancer. And the issues, the treatment options that are available to us now. We have some exciting information to share with you. Some very cool videos that we think that you'll find absolutely amazing. I know that I did. So for the next 30 minutes, it's all about you. It's all about your family, and as it pertains to lung cancer. And unfortunately, it affects a lot of families, and we're going to show you just how many are affected by lung cancer. So please weigh in now with your questions. If you would, it's there in the chat box. Just type in your question to us. We'll get to as many questions as we possibly can in this 30-minute segment, so do it right now. So now, though, let's welcome our expert from Kettering Health. Our expert is Dr. Soumya Neravetla. Dr. Neravetla, welcome, and thank you for your patience. Great to have you with us tonight.
Thank you for having me. I'm excited to be here.
Hey, a little bit about Dr. Neravetla. She earned a Doctor of Medicine degree from Northeastern Ohio University's College of Medicine in Rootstown, Ohio. She has extensive transcatheter aortic valve replacement, or TAVR, which we're going to be talking about, the acronym there, and that great experience. And she has launched and directed it in several different locations. We're excited to talk about that program. And she was the surgical lead physician for the Lung Cancer Task Force with Ohio Partners for Cancer Control. Doctor, thank you for joining us. Thank you for your patience. And before we kind of get started with our Facebook Live questions, tell us a little bit about yourself and how your journey began. Where did it start? Obviously in medical school. Where did you start there?
So I actually grew up in Ohio, not too far away from here. I'm a Springfield North High valedictorian from, well, not that long ago. But so I grew up in the area, and my father is a cardiac and vascular surgeon who's been in practice in this area for about 40 plus years, actually. So it, I guess, is kind of in the blood a little bit.
You literally, yeah. Well, he must be very proud of you kind of following in his footsteps.
Well, that's a funny story, actually. So my family, my father and mother especially, were very much not keen on my pursuing this pathway.
Really?
Yes. And in fact, I blame them because I tell them that the only reason I could possibly have followed in his footsteps is because they must have dropped me as a child multiple times. So they were hoping that I would choose something that was a little simpler and not as intrusive on your work-life balance. But here I am following in his footsteps. And there's not that many daughters who actually follow in their father's footsteps in this particular field. So,
well, we're glad that you did. How's the challenge been up to this point?
It's been quite the ride, but it's a very rewarding ride. So it's definitely a lot of sacrifices and a lot of hard work. But at the end of the day, it's very rewarding to make that kind of impact on people's lives on a daily basis.
Well, no doubt, and we're tickled to have you tonight. Now, I noticed a pin on your lapel. I'm assuming it has to do with lung cancer awareness?
Absolutely. Okay. So not many people know that November is Lung Cancer Awareness Month, and even fewer have any idea what the awareness colors are. So there's a white pin here for Lung Cancer Awareness Month, and then pearls, which I'm wearing. So I'm wearing the white in my dress and my pearls.
see.
Also in honor of Lung Cancer Awareness Month.
I didn't get the memo, or else I would have black and white. But
So-
you look much better in pearls than I was. Well, we're glad you're with us, and thank you for carrying on. And why do you think that lung cancer, I mean, given how deadly it is, particularly in our state, which we're going to show you evidence of that coming up, but why do you think that lung cancer is not as prevalent as maybe breast cancer?
In terms of the awareness?
Awareness, yes.
Yes.
Thank you.
So I think that's partially because of there's such a big stigma associated with lung cancer.
Really?
And in some respects, breast cancer is, I think, a more marketable cancer. You know, it's the pink cancer, right? So it's a very marketable way to show that you care about the, gender equity and females.
Sure.
But the irony is actually that lung cancer kills more women than breast cancer does. And so I think we actually have a little cartoon to kind of show that disparity between lung cancer and breast cancer. And that stigma is a very real problem because a lot of people blame the patient.
Yeah. I think that's a good place to start, Chris, if we could pull that up and kind of show that cartoon the doctor's talking about. And I think it makes us all kind of pause, like, well, I think what the cartoon points out is that stigma that you talked about. It says, I have breast cancer. Oh, I'll wear a pink ribbon and donate money, right? I feel so sorry. But if I have lung cancer, well, did you smoke? They cop an attitude right off the bat.
Right.
But smoking, yes, is a part of it, but not all.
Right. So if you compare November and October, I'm sure everyone saw pink everywhere. NFL was wearing pink.
Right.
Flight attendants were wearing pink. I mean, it was on the bananas. It's everywhere, right? Where it comes to lung cancer, that level of awareness just isn't there yet. The key point being yet.
Yet.
We are working on it.
And that's what these Facebook Live chats are all about.
Yes.
So if you have any questions about the stigma, about anything that pertains to lung cancer, please let us know in the chat box as we get started here. Let's just begin with the basics, Doctor. What causes lung cancer?
So the most common risk factor for lung cancer is actually smoking. So that is the primary underlying source for lung cancer most of the time. Any cancer is really just a proliferation of basically cells that have gone wild in your body. And so they keep multiplying over and over again without any control, and it causes cancer, whether it's in your lung or somewhere else in your body. But in the case of lung cancer, the predominant risk factor is smoking.
Okay. And then who is most at risk? Is male, female, or equal?
There's an incidence of lung cancer in both of them, and as we mentioned, lung cancer is the #1 killer in both men and women. So it is it doesn't play favorites. So it does affect both. And in fact, there's some disturbing statistics where lung cancer incidence in men is slowly declining, whereas rates in women are slowly increasing.
Is there a reason for that?
Some of it is because we think that there is some slow increase in smoking rates in women, but there's also some increased incidence of lung cancer in non-smokers. And the non-smokers with lung cancer does tend to be more common in women than men.
So are we talking about family history playing a factor?
There is some degree of family history, but when we look at the subgroup of non-smokers who get lung cancer that are women, they don't always have a family history of smoking, and I don't think we've truly answered the question of why that particular patient population is getting cancer. Mm-hmm. There are some genetic mutations that we often see when we do further testing, but what caused that particular genetic mutation, I think we still don't know all the answers.
So is there a problem there with research dollars just not funneling into lung cancer?
That is an excellent question, and I wish I had given you guys that little picture too. But there's another little graph that I have that shows it shows like a person versus a dollar sign. And when we look at breast cancer, the person shows the impact that cancer has on people. So how many people are affected by it? What is the impact that cancer is having on our population? And when we look at breast cancer, they've done a really good job because they've got a person and their dollar sign is much, much bigger than their their person. Whereas when we look at the lung cancer pictograph, unfortunately, the person's really is really huge, and the dollar sign is really tiny.
Yeah.
And so there's just not, whether it's federal funds, personal funds, people donating to the Pink Ribbon Fund, right? Whereas how many people donate to lung cancer research funds like they do to the breast cancer?
So you're talking about a public relations problem.
Yes, we need a better market. We need to hire a better marketing team.
Strategy there,
Yes.
for sure. Not to make fun of this, but it doesn't seem that if we have more deaths from lung cancer than we have breast cancer, it should be equivalent. Well, I wanted to get to a question real quick, Doctor, from Nancy. She said, "My mom died of cancer. So will I get it? Because I now have nodules in the same areas as hers, and mine's still benign, but curious. She was 74, I'm 58. What can you share with Nancy, Doctor?"
Yeah, sure. That's a great question, and a lot of people get nervous that just because their parents had lung cancer that they're automatically gonna get it. And it still goes back to the biggest risk factor being smoking. So if your mother was a smoker and you are a smoker, it's definitely something to be concerned about.
Right.
But not all lung nodules are cancer. There is a large number of lung nodules that are what we consider benign, as she referred to. And now, having said that, if you continue to smoke and you have a benign nodule, they can mutate and turn into something that it does become cancerous. Or you can get cancer down the road. As she alluded to, she's 58 and her mother was 74. Doesn't mean that 10 years from now that she may still get cancer, especially if she's a smoker. But that's where it looks like she is getting surveillance and they're watching that. And so just continue to keep watching that. If those nodules get bigger, then she may need a biopsy at some point to get that taken care of.
Okay, very good, very good. Kathleen says, "Is there anyone in Dayton that can perform a rigid bronchoscopy to replace a tracheal stent when a tumor has compromised the trachea?"
So it depends on the specific anatomy, but there are, we do offer tracheal stenting at the Kettering Health Dayton location, so I do know that is available.
God, we love these questions. Keep them coming. We are here for you to answer your questions. Now, is secondhand smoke still a predominant cause of cancer? I mean, it seems like we've done a better job of PR with that area, but is it still prevalent?
It's still a problem. There's still probably 3,000 to 4,000 lung cancers that are due to secondhand smoke a year. So it's not nearly as large as the total number, of course, because we're looking at almost 250,000 cancers a year.
Sure.
But still not insignificant.
250,000, man. I'm assuming, with breast cancer, they say early detection is the best protection, and I'm assuming the same goes for lung cancer.
Yes. And I think this is an area where we still need to do better marketing. And I think part of the issue is their screening test for lung cancer is a much newer test compared to mammography. So I think we've had time to really get the word out. But there is a screening test for lung cancer as well, and it's a low-dose CT, and we actually have a chart to show kind of what the radiation level of that is. So what that means is we get a lot more information than we would with just a plain chest x-ray that you might have gotten. There's another chart that actually has the level of the radiation, it's the bar graph. So when we look here, you can see that the level of radiation you get from a low-dose CT is only a little bit more than a mammogram, but a lot less than what you get from a diagnostic CT, and we get almost as much information. And so this allows us to find lung cancer when it's not causing any symptoms, so we can try to catch lung cancer at a much earlier stage.
You had another very interesting graphic that I wanted to pull up. Geographically, it has a big impact on your chances of getting lung cancer. I thought that was fascinating.
Right. So there's a map of Ohio, if you look at it, and darker blue is bad. So the darker the blue, the higher the rates of lung cancer. Now, having said that, the white areas aren't scot-free by any means. You can see there's still a significant rate of around 50 to 60 per 100,000. But the darker blue areas are definitely struggling more. And part of that in Ohio is because there's still a high rate of smoking, especially as we get into the coal territory. and our screening rates are clearly still need to improve, but that's unfortunately a nationwide problem as well.
Now, how does the state of Ohio compare to, say, like you mentioned, the coal states like West Virginia? Would that entire state be blue or similar to Ohio? Or
so,
more?
you'd be surprised. So compared to some of the coal states, we're doing better, but some of them we're doing worse. So there's still we have room to improve for sure.
Okay.
I would like to see Ohio doing much better. We're closer to the bottom 10 states as opposed to the I'd like to see us at least closer to the middle of the pack.
Yeah. I wanted to get back to what I think is a big part of it, at least unfortunately I smoked for 10 or 15 years, and I remembered I finally quit. And instead of people patting me on the back, not that I needed it or deserved it, but it would sure been nice. Instead of people patting me on the back saying, "All right, man, good for you for quitting smoking," what do they say? About time.
Yeah, right.
So I think that sympathy plays a big part into it.
Yes.
That if you just be sympathetic, if you want that person to be healthy, which we know you do,
right,
show some love.
Right. I think having that compassion for for all of humanity, right? But in particular, it's an addiction, and it's not like these patients who are smokers aren't trying to quit in most instances. And honestly, I spend hours a day trying to get patients to quit smoking.
Sure.
And so it is a big problem. But one of the analogies I make is if we kind of, rewind the clock and look back to when the AIDS endemic first started, there was a lot of that same stigma, right, that AIDS patients had. There was a high-risk behavior that was very common in most of the AIDS patients, and there was a period of time where those patients got stigmatized. Well, society rose above that and said, you know what, it doesn't matter, that's not appropriate. We shouldn't be stigmatizing patients or people regardless of their behavior or their personal choices. And I think we just need to take that same level of understanding, tolerance, compassion, empathy, and share that with smokers as well.
You had another graph that I thought was very interesting. Back to, it is the number one form, the deadliest form of cancer in our state at 26.5%. That, if we could pull that up, that is just staggering to me.
Yeah, so if you look at that graphic closely, lung cancer actually causes more cancer deaths than the next three combined.
That's amazing.
So it's especially if you look at the difference between lung and colon or lung and breast, and I feel like we do a much better job of reminding our loved ones to get a mammogram for breast cancer or get a colonoscopy or get a colon-fit test done for colon cancer. I feel like we're much better about reminding loved ones to get screened for cancer, whereas when we have a loved one who's a smoker, rather than saying, hey, can you should get screened for lung cancer, we're usually just pestering them about their behavior and not saying that we shouldn't encourage them to quit smoking. That is by far the best thing a smoker can do, is quit smoking, and that is absolutely an important message to be received. If you smoke, please quit, and if you don't smoke, don't start, because it's really hard to quit.
But doctor, they make them so darn addictive nowadays.
Yes.
And behavior is a difficult thing. You really have to want to quit. You got to flip that switch in your mind. I mean, at least for me it was. I just went cold turkey. Right. Didn't do the patches, didn't do the gums. I said, darn it, not the word I used. I want to quit. And so it's a mind thing. So how do we change that behavior when you're dealing with a drug that is so addictive?
Yeah, it's very challenging. And in fact, one of the more worrisome things now is with e-cigarettes. I mean, a lot of there's kids now starting smoking at much younger ages.
Yeah.
We were, prior to the advent of e-cigarettes, we had made a lot of progress in smoking rates in kids, in high school and college and young kids. And then when e-cigarettes started, we took a huge step back. And
why do they consider that to be okay when smoking is not?
Well, one of the things is it's really convenient, especially, and I think that's part of the reason why Juul has now is no longer available and is becoming more and more illegal. But it almost looks like a thumb drive, some of these products. And so it's really easy for them to sneak it into school. It makes it a lot easier. The other thing that is specific to e-cigarettes is all the flavors. And the flavors, especially in kids, it makes the interest level in trying it much, much higher. So the threshold for trying something it's not as disgusting as a cigarette, let's be honest. Like anyone who's smoked will tell you that their first cigarette was probably not the most pleasant experience.
No, not at all, not at all. Hey, real quick, I wanted to make sure that we're running out of time here, but I wanted to make sure that we talked about, show some of the video of this fascinating process that you have, the world in which you live every day. To me, I mean, this is a heck of an office. Chris, if you can pull up that video. Look at this, everyone.
So I'm a surgeon, as Dan pointed out earlier, and so this is a clip from a robotic lobectomy. And right here, what I'm doing is actually starting off the procedure with taking the lymph nodes. And one of the advances of the robot is it allows us to take these lymph nodes with a lot more precision, and so we can do a really good quality lymph node dissection. And why that's important is sometimes tumor spreads to the lymph nodes, and if we don't know that well, then we may not be giving them the appropriate additional therapy that they may need. And we also believe that we're doing a better job of clearing the tumor when we get these lymph nodes out.
So what are you doing here, Doc? You're lifting back?
So right here, that's another lymph node on an artery. And so that's an artery that's right under that lymph node, and you can see that this robot gives you such precision that you're able to just peel that lymph node off the artery with a lot more gumption than you otherwise would.
But you're controlling the robotic arm here,
yeah,
and the pinching and everything.
Absolutely.
Okay. Ladies and gentlemen, I'm sorry I didn't warn you before we rolled the video. It can be, somewhat, particularly around the dinner hour, that could be a lot to digest there. But that's the world in which you live. And Lisa has a question for us. She says, I have breast lumps removed. Now I have COPD and lung cancer and get lung scans and mammogram done yearly. Should I worry about the radiation that we just showed them?
Yeah, and so that's what's the great thing about the lung cancer screening test is it has so much less radiation than a regular diagnostic CT. So both tests are designed to be very low radiation, and if you remember that graph that we previously put up, the radiation that you're getting from both those tests is less than the radiation that you're getting from just living in the United States on an annual basis. So it's still really important to be getting those screening tests. And when we make any recommendation, we've weighed the risks and benefits, and so there was a lot of studies that were done to look into things like that, like are we causing more cancers as opposed to catching cancers, and when you meet those criteria for any of those screening tests, it's because data shows us that the benefit of that screening test far outweighs the risk.
So obviously screening, early detection, as you mentioned, is the best protection, but can you share with us maybe some of the symptoms that lung cancer is prevalent? Right.
So the most common presentation for lung cancer is truly asymptomatic, which is why screening, as you alluded to, is so important. But if you can get shortness of breath, coughing up blood, or even just any kind of regular cough,
persistent cough,
chest pain, there are hoarseness. There are symptoms like that you should definitely go see your doctor about if you're seeing those symptoms. But when you think about it, your lungs are pretty big structures, and a lung cancer in an early stage is usually just 1 to 2 centimeters, and it's just chilling out in the middle of your lung, not really bothering anything. And so you're typically going to get a symptom. By the time you get symptoms, you're usually going to be symptomatic. And Chris, if you don't mind showing up that pie chart that we have, that's part of the problem that we have right now, is that about 3/4 of lung cancer right now is detected when it's a late stage. And so that local blue in the pie chart is where we really want to be diagnosing lung cancer. And instead, we're diagnosing it after it's already spread. And that's because the majority of lung cancers right now, we're catching what we say incidentally. Or it's kind of like an, by the way, someone went into the ER with chest pain, or went to the ER for something else, or had a chest x-ray because they were having a surgery scheduled. And by the way, there's a lung nodule.
Saw that. So maybe this is a dumb question, but is it easier to detect cancer in lung or breast tissue? Or does it matter?
Well, that's actually a good question, but I will tell you the low-dose CT test is actually a very quick and painless test. It's actually easier than a mammogram. So fear of the test should not be an obstacle for getting it, and it's covered by insurance.
So let's walk through the process for someone watching right now who thinks they or maybe someone they love has lung cancer. Where do we start? We get that screening, we detect it. What's the timeline from there?
Yeah. So after that, if there's something abnormal on your lung cancer screening test, your doctor will probably refer you to another specialist. And at Kettering Health Dayton, actually, and at the main campus, we now have a lung nodule clinic that makes that a lot simpler. And so if you go to a lung nodule clinic or some kind of specialist, they'll help expedite your pathway from there. But the next step is going to be some kind of biopsy, because if we see a suspicious mass or something suspicious on a scan, we need to prove that it is something. And so at some point you will get a biopsy. There's also going to be further testing with other special scans, like a PET scan, which will look for cancer elsewhere in your body. When we talk about the biopsies, there are different techniques for biopsy. So you could get a needle either coming from the outside that the radiologists typically do, or you could get a needle from the inside, which is where I, as a surgeon or a lung specialist like a pulmonologist, would be able to do that procedure. Once we've shown that you do have lung cancer, that's when we look into what we call staging. And so that we're trying to figure out how far has the lung cancer spread. And so that's where that PET scan can come into, but sometimes we do some additional biopsies of the lymph nodes around the airway to see if they're involved as well. And then ultimately, once we've done the staging process, it comes to treatment. Mm-hmm. And treatment for most cancers, lung cancers including, comes down to essentially 3 modalities. One is surgery, the next is chemotherapy, and the last is radiation therapy. Now, we really try to do surgery for as many patients as possible because that has a really good rate of cure. So if we catch it earlier in that blue part of the pie chart from before,
right,
your chance of being able to be eligible for surgery is much higher, and the cure rates are also much higher. Mm-hmm. But there have been advances in chemotherapy and radiation as well.
So to be positive here, if we can catch this in its earliest stages, we have a pretty good chance of survival, don't we?
Yeah. So the survival rate between the blue part of the pie chart versus the red part of the pie chart is dramatic. It's a very dramatic difference.
Well, the one thing Kettering Health does very well is every stage of the way, if you will, there's always that mental component too, that they mm-hmm. want to help you mentally get through this, which
right.
is obviously a life-altering event. Mm-hmm. And you guys do such a good job at that.
Right. And we have some dedicated navigators now that
right.
are focused on the lung cancer part of things. So when we launched the lung nodule clinic, we have some dedicated people that are focused on the lung cancer patients that really help navigate
right.
that pathway.
And I know this is no excuse, but during the pandemic, we had so much isolation. I mean, what else was there to do than smoke or watch TV or listen to the radio or music or whatever? Did you see an increase at all in patients because of the pandemic, because they were nothing else to do? I hate to say that. But.
Well, so what's interesting is actually because of the pandemic, we actually saw a decrease in the patients, not because we think there's a decreased incidence of cancer,
right.
but because patients weren't actually going in to get checked.
Oh, I see.
And so there's actually been a lot of research done that we think there is, like at this point, it's almost countless, the number of years of lives lost that we think in the initial lockdown itself,
right.
we think we lost about 30,000 years of lives lost due to the delay in people following up.
Could you repeat that?
30,000 years of lives lost. And that was just from the initial phase of the lockdown.
That's amazing.
So if you tack on the fact that
right,
next year, it's a very significant decline. And really honestly, it impacted all the cancers. Mammogram rates went down, colon screening went down, and all of that translated then to biopsy rates went down, and then treatment rates went down as well. And so what I did notice after the pandemic is I was seeing more advanced cancers. The rate of the pie chart that we just showed you had been moving in a positive direction prior to the pandemic, and then definitely took a slide back in the negative direction during the pandemic.
So you just didn't catch them earlier in the phases that you were catching.
Yeah.
Right. Hey, Chris, if we can squeeze in one more question here, we're just about out of time. I think we had one more that we wanted to make you tap dance there a little bit, Chris. But yeah, I hear from Jody Lee. She asked, well, thank you for the information. Prayers for everyone involved with this. And I wear pearls for my dad, who was never a smoker. Isn't that a kick in the pants?
Yeah.
Yeah. So keep wearing those pearls, doctor.
Yes.
Anything else you want to share with us before we sign off with our crowd tonight?
I just want to remind everyone that lung cancer is the #1 cancer killer, and to have the same compassion for the smokers in your lives, really encourage them to get screened for lung cancer. And the things to think about, if they're basically over the age of 50 and they have a smoking history, it's worth having them talk to their doctor about getting screened for lung
You say
cancer.
50 is the kind
50.
of the...
Yep.
Okay.
50.
All right, super.
So if you're 50 and older and you have a history of smoking, it's worth talking to your doctor about whether a low-dose CT to get screened is right for you.
Let's catch you that early phase here if we can.
Yep.
Dr. Neravetla, thank you for your time. Great information tonight. We do appreciate it. We're lucky to have you in the Dayton region. And if you'd like more helpful information about this topic, we urge you to go to Crucial Catch with the Cincinnati Bengals, right there, ketteringhealth.com/Crucial Catch, and to give you all the information that we've been talking